Our next speaker is Dr.Alaa El Hussuna. Thank you so much, sir, for taking the time out and being a part of the Global Virtual Healthcare Summit 2022. It is an honor to have you as one of our panelists. Before we begin, a little introduction on Dr. Alaa El Hussuna. Dr. Alaa El Hussuna is a leader of the Open Source Research Collaboration International Research Organization that aims to develop new research tools through the implementation of information technologies in medical research. He is a chairperson and co-founding member of the European Society of Colo-Proctology, ESCP, cohort studies committee that conducted many prospective international audits and studies. In 2017, he worked as a leader of the European Society of Colo-Proctology, which focused on the left colon, sigmoid, and rectal resections. Overall, data was captured on 5,641 patients at 335 sites across 49 countries. In 2020, he worked as a member of an expert panel to work out the National Action Plan for the Treatment of Autoimmune Diseases, which was presented in the Danish Parliament. He also worked as an associate professor of surgery at Aalborg University. He is an author of 70 articles published in peer-reviewed international scientific journals, including 13 reviews. He's an author of 22 published conference abstracts. In 2021, he worked as a member of the ECCO Guidelines Working Group to write roadmap to optimal peri-operative care in IBD. Dr. Alaa El Hussuna, I will now pass on the presentation rights to you.
Thank you very much for this introduction. It made me realize that I'm becoming all these things.
So, we're honored. Thank you.
Yes, thank you. So I'll try to share my screen. So thank you for this opportunity. I was looking forward to talk about this subject. Well, as you said, open source research is focused on implementing information technologies in medical research because we believe that traditional research cannot answer the challenges that healthcare system have them. The organization was founded for a couple of years ago. It is growing in the number of the participants. We have about 1,000 now or more, and it is growing. We are multidisciplinary, so we have participants or members from surgeons, physicians, computer scientists, IT engineers, and medical students in these fields. The organization have 15 partners, and it has published more than 18 scientific papers since it was founded. So I will talk today about one of our projects, Human Anatomy project. And this is one of the projects that we are doing in open source research. We're doing many other projects. You can see more about our projects on our website. So just short introduction about the background. We know Human Genome project because it is one of the greatest scientific feats in human history. It was launched in 1990 and completed in 2003, generating the first sequence of a human genome. The project was critical for advancing policies and earning increased support for the open sharing of scientific data. It was the first large, well-organized, highly collaborative international effort. As you see, it took us many decades from starting from the discovery in 1953 of the double helix to the 2003, where we got our first human genome code decoded. But how did the human genome affect scientific research? Well, because the genome sequence was publicly available shortly after production. This has stimulated the scientific research. This is an important point. The scientists working on this project agreed on something that they called it at that time Bermuda Principles, which set out the rules for rapid release of sequence data and increase awareness and openness to data sharing in biomedical research. This is a very important point, sharing data. I will come to this point later on. The cost of the project, initial cost was about $3 billion about on the 15 years of the project. And it was justified because the positive economic benefits that the genomic has yielded in the ensuing decades justify these costs, and economic gains generated reflect direct link between the genome decoding and the advances in the pharmaceutical and biotechnological industry, among others. How did this project affect the biomedical research? Look, this project was production-oriented, discovery-driven scientific inquiry. What does this mean? This means that it didn't involve the investigation of specific hypotheses or direct answering of pre-formed questions, which is remarkable value for the scientific community. It was an example of big science in biomedical research because the magnitude of the technological challenges prompted the Human Genome Project to assemble interdisciplinary groups from across the world. These interdisciplinary groups involved experts in engineering, biology, computer science, among other areas. Before the Human Genome Project, the biomedical research community viewed projects of such a scale with deep skepticism. This kind of massive scientific undertaking became commonplace and well accepted after this project. In reality, Human Genome Project was the end of one journey, but the beginning of another journey. Maybe the beginning of another journey is led by open source research. Let me show you what I mean. How about having all the anatomy, human anatomy variations, like we had the genome variations? So we call it Human Anatomy Projects. Can we do this? Yeah, why not? Most of the patients, they have pre-operative CT scans. We can do 3D reconstructions of these CT scans. And we have minimal invasive surgery. And these minimal invasive surgeries, we have usually video films. Combine all these using computer vision algorithms, then we will get Human Anatomy Project, or we will get variations in human anatomy. Is it important? Do we need it? Well, as a surgeon, we need training. Training not only for the junior surgeons, training also for the senior surgeons when they are trying to modify an existing procedure or introducing a new procedures. To do this, we need good simulators. To do this, we need very good knowledge about human anatomy. We cannot train on an anatomy model and then we come to the patient and there is another thing that we find. So this is very important. If we know the differences, variations in human anatomy, then we can plan our surgical interventions. And then this will affect the outcome and will improve the outcomes. Combine all these informations, we put them in a data, analyze these data, make some algorithms, and reiterate, and so on. Is this important? Yes, because if we have this knowledge, we can do better preoperative optimization of our patients. We can do better surgery with reduced surgical stress response, and we can have better and quicker post-operative recovery for our patients. But, and it's a big but, there are challenges. Any artificial intelligence surgical research have challenges. Let us start with the most challenging thing, data protection. Personally, I think there is more data protection on research than on other fields. Even if you take the same data, it is more protected in research context than in other fields. And this is really not for the benefits of the patients. We need to protect the data, but we need also to ensure that data can be used for the benefit of the patients. Data protection is one of the challenges in this project, but this is not unsurmountable. It can be addressed if there is a will, if there is a political will. We had the same challenge in worldwide genome project. It is more sensitive data. The genome of the people who participated in the project, it was more sensitive. So this is possible to do the data protection and get large projects at the same time. We need good funding. The maybe more than the 3 billion that we use for the genome project. We need to develop techniques to transfer and save large data files because CT scans, video films, they are very large data files. But this is also possible with the modern technology and the speed of the internet. We need to structure multidisciplinary teams composed of engineers, computer scientists, data scientists, in addition to clinician and anatomists. This is also possible. I believe that the best way to start this is through building local multidisciplinary teams that will tackle specific tasks, and these tasks will formulate the whole picture of the project based on academic research. And this is important because in open source research collaboration, we aim to base our innovation on solid scientific foundation. This is very important for us. And maybe if we can get there, the last step, or not the last step, but one of the steps, important steps, is to get patent for what we have done in the previous steps. For this end, the open source research collaboration have established different teams in Egypt, in Denmark, India, and we are also establishing another team in Turkey, working on these projects. So maybe you wonder how this organization works. Well, it is an international research organization, and we embrace the use of open source products, and we embrace the multidisciplinary team approach. So we do academic research, we have educational activities, we have huge international collaboration, and we are aiming to raise the public awareness about challenges in medical research and why we need to implement information technologies to tackle these challenges. Maybe in the future, we will have some spin-off startup based on the academic research that we are doing. We can help researchers, innovators in the world through our vast network of experts. We can help in designing projects, connect to data scientists. We can help in international collaboration and dissemination on our vast social media network, and we can also help in public relations in addition to educational activities. So in conclusion, we have big projects, but as I started, Human Genome Project was big when they thought about it, and then now it is a reality. So it is an invitation to everybody who hear this talk to join open source research and be actively involved in those projects. These projects are for all human beings and all are welcome. Thank you very much.
Thank you so much, sir. I think it is wonderful work that you're doing already. I will give the audience a minute to ask any questions that they might have. So one question, Dr. Hussuna, that we've got is, Does the OSRC network also accept medical students and universities as a member?
Yes, this is a good question. Actually, we have many of the medical students accepted, and we have special discount for the medical students. We also aiming to engage medical students in our projects. Most of our projects, they are done with presence of medical students or students from computer science departments. So students are very welcome to join the organization, take part in the research, and develop their skills. It is not only about research, because when you join the organization, you can develop your communication skills, organization skills. You can participate in educational activities, and in this way, you develop your skills. And when you develop more of those skills, you can take some leading roles and develop your leadership also. And all this can be used in your CV.
Absolutely, absolutely, I agree. Another question we have is that the network also organizes workshops and boot camps. So, what is the process of getting the workshops organized? And have there been any workshops done in India before? Yeah.
Very good question. So yes, it's one part of our activity is organizing educational activities. We have done workshops in Iraq, in Turkey, and we have done a workshop last month in India, in Kashmir, and it was about artificial intelligence in surgery. It was great success, very highly attended, with hands-on exercises where the participants, they had the opportunity to present their projects, get them discussed, and form the multidisciplinary team to work on these projects. We would like also to organize more of those workshops. If you want to do this, please contact me, and we will communicate about this and organize a workshop. And I would like to say that the next workshop will be on the 27th to 28th of April in Cali, Colombia. Everybody is welcome.
Excellent. Another question is there a minimum number of attendees that you require to organize a workshop in a university?
Well, we don't have some specific number, but from our experience, we always aiming to attendees more than 50 to enable group discussions, because those attendees will separate into groups and they will have some group discussions. So 40 to 50 is about the minimum number.
Okay. There is one last question. Based on your experience and expertise, what is the future of AI in surgery? They want to know a little more detail about it. I think we also have some time, so maybe you could throw some light on that.
Yeah, very good question. And I love to talk about this subject, actually. We had stagnation in surgical science. We need to push the surgical science. We need to push the innovation in surgery. And here, artificial intelligence can play a great role. The way to do this, there are many attempts to implement artificial intelligence in surgical research and surgical innovations. But until now, they are very limited, and the innovation that's happened from this is still in its infancy. We need to focus on some areas where we are standing strong. One of those areas is surgical simulators. Because the pilots, the astronauts, they get very well trained on the simulators before doing their first practical attempts. We don't have the enough volume of the operations to train everybody. So what we need good simulators. Here, artificial intelligence can help us to build those simulators. So we would love to, if people are interested to hear more about this, we would love to arrange a specific workshop. And as I told you, that we are multidisciplinary. So there will be surgeons, there will be clinicians, there will be computer scientists and data scientists in this workshop. There will be good discussions and hands-on exercise. Hands-on exercise is that you get the opportunity to develop your own idea with the help of all those experts around you. So it's a good opportunity, and I encourage my my audience to take this opportunity.
Yeah, I'm sure they're all listening, and I hope that they're encouraged to learn more about this, and they do get in touch with you, or they can get in touch with us, and we will put them in touch with you.
Sure. Thank you.
Yes, so that was the last question. Thank you so much, sir, for taking the time and talking about such interesting things that you're doing. And we really hope that we're able to see you do better things moving ahead, and a lot of stuff in the APAC region.
Thank you very much. Thank you for the invitation.